Most caregiver injuries in aged care settings are caused by manual handling tasks, such as lifting and transferring residents. In this video, we will show you how to safely transfer a person from a chair to another seated position. We will particularly focus on correct caregiver positioning, choice of sling loops, and communication. Before you begin any lift, always carry out a risk assessment for both your safety and that of your residents. Check that the environment is clear of hazards and is uncluttered. Check that the equipment you're using is in good condition. Check that the resident is safe to lift and explain to them what you're going to do. This is all part of your dynamic, day-to-day risk assessment.
Before applying, check that straps and labelling are visible on the outside of the sling. Then, ask the resident to lean forward or assist them in doing so. Carefully feed the sling to the base of their spine, ensuring that it is positioned centrally. One at a time, ease each leg strap down the side of the resident's legs. Do this carefully to avoid dragging on their skin. Bring each leg strap under the resident's thigh. Placing their foot on your leg will allow you to do this with greater ease. Ensure that the straps are smooth and the fabric does not gather. Notice how Aspire slings have a yellow central loop. This can be used for additional dignity and comfort during the lift. When carrying out the transfer, one carer should look after the resident and the other should operate the lifter. Lower the spreader bar to chest level. Extra care should be taken to ensure that it doesn't come into contact with the resident, causing harm. Next, attach the sling to the lifter, ensuring the loop sits securely on the spreader bar. Sling attachments may vary. Always ensure you understand and follow correct procedure. And the loops you choose will differ from resident to resident and depending on the transfer being carried out. In this instance, we are moving from a chair to another seated position. Therefore, we are choosing short loops at the shoulders and longer loops at the legs. It is important that both caregivers communicate with each other at all times, especially when attaching the sling to the lifter. Shoulder straps must match each other and leg straps must match each other to ensure that the resident remains safely in the sling. The lifter's brakes should be off to accommodate for the sudden shift in the lifter's centre of gravity. Tell the resident what you are going to do and begin the lift, ensuring their arms are inside the sling. When the sling becomes taut and just before the resident's body leaves the chair, check that all sling straps are still securely sitting in the spreader bar. If they are not, bring the resident back onto the chair, adjust, then continue your lift. Lift the resident just high enough so that their bottom will not drag on equipment during the transfer. When moving the lifter, don't forget your safe manual handling practices. This is an example of an unsafe way of moving the lifter, putting your shoulder at risk. The shoulder joint is one of the most commonly injured body parts when moving and handling residents. Protect yours by keeping your elbows by your side and below shoulder height. Remember, while one caregiver is controlling the lifter, the other should be protecting the resident and ensuring they do not come into contact with the lifter, causing accidental harm. Notice how the caregiver brought the wheelchair to the lifter. This reduces the manual handling effort and should be done whenever it is safe to do so. When the resident is at the desired destination, guide them as the lifter is lowered. When they are sitting safely, ensure that there is enough slack in the sling straps and carefully detach the sling from the lifter, making sure that the spreader bar doesn't come into contact with the resident. Take the lifter out of the way and remove the sling. The sling's material is gently being folded back, not pulled or dragged. This care will help to avoid skin tears that cause harm to your resident. Remember these steps and our 3 focus points: correct caregiver positioning, choice of sling loops, and communication for safe resident handling in chair-to-chair transfers.